had the melanoma. That would have came from his back, because he had melanoma on his back. Yeah, so that's part of what we do. We try to manage and diagnose these conditions. This is the abbreviation for optometrist. You'll see this as we go through. When you see OD, you're like, who's that again? Well, doctor of optometry, OD. We prescribe medicines. A couple of examples of that would be if somebody comes in with pink eye, I'll prescribe a topical antibiotic. If somebody has an eye that's in a lot of pain, I might prescribe some tramadol or some other narcotic. Low vision rehabilitation. Okay, these are kind of cool. You guys are too young, but maybe you have a grandpa or grandma that really just can't see anymore. Maybe they've lost a lot of their eyesight from diabetes or something like that. We, as optometrists, can actually prescribe magnifiers that mount on the glasses. It's like a little telescope. So if you've lost most of your vision, you might be able to just see a little bit by looking through there and be able to see the television. These are like from the 60s, by the way, really cool. So you can kind of look through there and pass those around. But that's an example of what an optometrist might do, is to recommend a magnifier for somebody. Yeah.
He made me wear those for a week.
That's right. Looking through that makes you appreciate what it's like to have good eyesight. We all take it for granted until it's gone. Vision therapy. Anybody know what vision therapy might be? What that is? So, anybody know somebody that maybe has a lazy eye? Okay, so if there's an eye that maybe drifts out just a little bit, or maybe just drifts in a little bit, we'll recommend some eye exercises for patients to kind of train those eyes so that they work together a little bit. It's usually done in the younger population. We prescribe glasses, contact lenses, and minor surgical procedures. An example of a minor surgical procedure would be if somebody comes in, they have a skin tag on their eyelid, I'll take it off. Or if somebody comes in with a piece of metal in their eye. Maybe they're building a house on the side like Mr. Kostrowski, not wearing their safety glasses all the time, and a little piece of something will get in the eye once in a while. They'll come into our office and we'll take care of that for them. Most of you that have had eye exams, Jessica's laughing at my slide. Do you know what that is? Yeah. So most of you that have eye exams, this is what you think about. You're sitting in the exam chair. This is called the phoropter. We have a series of lenses that you'll look through and say, all right, which is better? 1, 2, 1, 2. By the way, there's really no wrong answer. We already kind of know the answer before we do that test. We're just doing it to kill some time. And the nice thing about this now, for Apple Watches, I can do that with my text message at the same time. Really? I was kidding. Okay. I would never do that. No, if I had an Apple Watch, I wouldn't. This is an example of administering some eye drops. The most important part of the eye exam is the eye health part of the exam. Most people think they come to an eye doctor because they want to get some new glasses or new contact lenses, but we're really examining your eyes to make sure that they're healthy. And that's what I'm doing here. This patient is sitting there and I've got a microscope with a lens I'm holding, and I'm looking through the pupil at the back of the eye. Yeah. What do we see there? Isn't that kind of cool? Yeah, that's just some excess herniated orbital fat right there. All right? And this is something that really doesn't hurt anything. It's not going to be bothersome for the patient. It's not going to affect their eyesight. They, looks nice. Actually, it's a lot clearer than using the one.
Yes,
right?
a lot clearer.
Yeah. So that's an example of something that might come into my office. Those of you that wear contact lenses, if your eye doctor says replace them every 2 weeks, replace them every 2 weeks. If your eye doctor says replace them every day, replace them every day. If you don't, this is the kind of things that can happen. So this patient overwore her contact lenses. When I flipped over her eyelid, it was all beefy and red like this. So the contact lenses are uncomfortable. They hurt, they slide around, your eyes itch like crazy. Once we see this, it takes a long time to go away. So you should be replacing your contact lenses on a regular basis as recommended by your eye doctor. Don't overwear them, especially if you want to wear contact lenses for a long time. You can wear them until you're 80 years old. lot worse than what it is. This is just a broken blood vessel on the eye. It's called a subconjunctival hemorrhage. And you can see this is all red, and the blood is kind of pooling in this area right here. These can happen from trauma. Somebody punches you. They can happen if you are vomiting too hard. Okay. I saw a little boy 2 years ago that was severely constipated, and he was pushing so hard he got these in both eyes. Okay. So there's a lot of different things that can cause these. They look nasty, and they take a long time to go away, usually about 2 weeks. But in most cases, it's nothing to worry about, unless they reoccur. If we see this over and over and over again, that means maybe there's a bleeding disorder. Maybe you should be checked for things like anemia. Okay. Now this is quite a bit more serious. This is actually a laceration of the globus. Right? This is from glass. All right. Something like this has potential to really cost the patient their eye, because there's a pretty good chance they're going to end up with either a cataract, a retinal detachment, or worse, a very, very serious infection in the eye called an endophthalmitis. Okay. Personally, I don't see a ton of these. People don't walk into my office with a laceration. It does happen. They usually end up in the emergency room first, and then after their triage there, they'll come back to my office.
Do you just let that heal, or do you sew it, or?
This one is going to be self-healing. The patient's going to be given antibiotics topically and orally for 10 days. And fingers crossed. Yeah. Anybody had an eye injury? They hurt. Yeah, there's a lot of nerves on the eye. Even like a fingernail scratch will just really, really hurt. The eye has a lot of nerve endings. Okay. So again, I never know from day to day what I'm going to see on my schedule. This is an example of a 10-day-old infant that I saw last year. You're like, why? And what are you doing here? The child was born, and the pediatrician was taking a look at this little infant, and he actually had a white pupil. Okay, you know, pupils are usually black, right, because they're a hole in the eye. This kid had a white pupil, so they were very concerned about a congenital cataract or worse, a tumor inside the eye. And they don't have the equipment to look at them, so they'll send them to my office and we'll take a look at them. Okay. Again, fortunately, we don't see a lot of these. By the way, kids under the age of 1, piece of cake when it comes to an eye exam. Right, Jess? They just sit there. You put the drops in, they kind of blink a little bit. Yeah, they don't do much. A 3-year-old will try to kick you in the crotch. They're screaming, their head's spinning, it's rotating on axis. You know, they're tough. 3-year-olds are tough, 1-year-olds are easy. All right?
So what did you find out?
It was nothing. They just didn't have the right, they were looking at it at the wrong angle, so they were getting a reflex. But they just went straight on. Okay, who knows what this big word is? Heterochromia irides. Hey, very good. Somebody gets a... There's a couple of them. Let's get going, Jess. Come on, we gotta get rid of those. So, this was another child that I saw because it's a little hard to see. They had 2 different colored eyes. Can you appreciate this one's darker and this one's a little bit lighter? Okay. There's 2 possibilities here. Either this child was born this way and it's congenital, or they have a very serious eye problem like glaucoma, which can show up in infants. Okay? In this case, it was just congenital. The child was born with it. We just need to observe it to make sure there's nothing else going on. Kids are kind of fun. They don't complain too much, especially at this age. Okay?
Love that little small.
It does a little bit. You know, it's a little red here too. Sometimes they're just waking up, or sometimes they're crying before I see them. Especially, well, usually if Jessica protests them, they cry quite a bit. I like this slide. This is why my day's fun. This kid actually came in for an eye exam dressed like this. How do you not laugh? Isn't that great? He just comes in wearing this Captain America outfit. I'm like, dude, you rock. This is awesome. Again, that's why this profession is so fun. Okay. What's this? What's this word? Anybody pronounce it? Nope. Ptosis. Ptosis, right, okay. What's a ptosis?
Oh boy, what's osis?
Close. Mr. Petrovsky, did you guys anything?
I'm just gonna stick with my midterm book open. Alright, what are we trying to figure out what it is?
So this kid has a droopy eyelid. Right? Ptosis, droopy eyelid. See that on the left side? It's not open as much as it is on the other side.
Abnormal condition.
All right. So again, now, the challenge is, this patient was sent to me by the Aspirus Pediatric Department. Is this congenital? Was this little boy born with this? Or does he have a space-occupying lesion? Right? So it turned out it was nothing, just a congenital droopy eyelid, also known as a ptosis.
So can you train that?
So abnormal.
No. So one of two things will happen. Either it'll stay like that forever, which is really not big of a deal, or sometimes they just slowly get a little worse. I had a girl a couple years ago that I saw when she was 7 that had this. By the time she was 14, she needed surgery because it was just all closed. They usually don't change. Usually stay about the same. All right? Yeah, so you guys don't know me well, but I will tell you, most optometrists are kind of nerds. And so what do we do for fun at home? And you guys are watching Netflix. I'm doing eye exams on my dog. All right? So this is a Springer Spaniel, this is Oakley. And what I have there is a handheld autorefractor. So those of you that have been to the eye doctor, you look at this piece of equipment and it prints out your eyeglass prescription. I actually have a handheld portable one, which is great for infants. But I thought, I wonder what Oakley sees, right? So I took it home and she's a perfect dog. I said, look straight ahead, I got an autorefractor reading on her. She's just slightly farsighted, just a little bit. And the second thing I want to tell you about this slide.
His daughter likes to pick on him about that.
Yes, and now I can finally, my daughter's 25 and she's not quite as smart as you, maybe. But she, every time you look at this, she goes, Dad, look at this, socks with sandals. I read this summer in GQ, socks with sandals are the way to go. Ready?
Yeah, they're like split-toed. Those are flip-flops. Yeah.
Doesn't matter. I was ahead of GQ magazine
pointed out was
2
why
years
do you
ago.
socks and sandals?
So I'm sorry, there was a question back here.
Oh, good.
You have a question?
Well, I was just gonna ask why you were wearing socks and sandals.
Like, I mean, if you're
Because
wearing
he's
socks.
getting a new trend.
But it's okay if they're like
Okay, if you
not split at the toe. The
That's
issue is it's split at the toe.
You have flip flops on. If it was like Crocs
So my other
versus
sandals are like
socks or
leather and all
slugs.
encased and stuff, that'd be okay?
Like what Tasha has on.
Tasha,
Those are okay.
Talk about sandals like that.
Those are okay.
Oh. Well, either I'm gonna retake this photo or
Hey,
delete it.
at least they're not white.
That's right, yeah, right. Okay, next. All right, and next. Contact lenses. Again, we talked briefly about contact lenses. I think 30% of the patients I see on a daily basis are being seen with contact lenses. They're very popular, they've been around for a long time. The latest trend is daily disposable lenses. Oh, I forgot to tell you guys something really cool, I forgot to bring them. You guys heard of Oasis contact lenses? They've been around forever. They now make transition contact lenses. You go outside and they darken.
No, man.
Yeah. So you go outside, play soccer, they darken, you come back in the building and they're clear. They're really, really, really cool. It was, the contact lenses that darken were the Time Magazine Invention of the Year in 2018. Okay, we have them in our office. I have fit quite a few people with these. My son has actually worn them a little bit for soccer. He said they're great. They don't take the place of sunglasses, but you know, sometimes you just can't wear sunglasses. Anybody wake surf, water ski? I wake surf quite a bit. I love being on the water. I can't wear sunglasses when I'm out there. So the contact lenses that darken are really nice, a nice option. Brand new product. Really, really excited. All right. I have in my office, by the way, my office is on 17th Avenue. We're not that far from here. I have a lot of pre-testing equipment. I have 18 employees. A lot of my patients spend a lot more time with my technicians like Jessica here than they do with me. Patients come in, those of you that have eye exams know this, they go through some of these tests before I see them. One of the coolest things about optometry is you get to play with a lot of really cool equipment. It's really a lot of fun. Of course, I'm a nerd. All right, next.
What is that machine?
So this one right here is the autorefractor. Again, this is the one that gives me your prescription. So you look in there, try to focus on something, and it prints out your prescription. It tells me if you're nearsighted, farsighted, if you have astigmatism. All right. This one here is the tonometer. You guys all had a fancy little air puff machine. It measures pressure in your eyes. Yep. We're testing for glaucoma.
Oops, sorry. I got pressure on my eyes.
Yes. There's 3 of them. We would probably have more, except we're completely.
So what's the fire?
And then the far one is the visual fields test. We're checking your peripheral vision. The old-fashioned way of doing that was, I would say, look at my nose, how many fingers, how many fingers, how many fingers. But there's actually automated equipment that does that. What do you guys see here?
Bugs.
A pebble. That's something that's not supposed to be there.
Yeah, exactly right. It's a piece of rust.
There's an eyeball for that. Boomba.
All right. So these tend to be
I want an eyeball.
painful if you've never had a piece of metal in your eye. All right. Usually what will happen is somebody will be working like underneath a car and something will fall in. Or it happens at work where they work with some metal shavings, that sort of thing. And what I'll do is I'll put a little anesthetic in the eye so it's completely numb. And then I take a tool, looks like a little golf club, it's called a spud, and just lift it right out. And then we'll put the patient on an antibiotic eye drop for 4 or 5 days.
Are they awake when you do that?
Oh, yeah. So, that's a good question. If these are off to the side like this, what I'll do, it's kind of tricky, I'll come in from the side so the patient doesn't see the tool coming at them. But if it's right dead in the middle of the cornea, those are really tough, because they're sitting there and they're seeing it coming right at them. And then, because it's metal, I often have to use what's called an alger brush to drill the rust out. And this thing, zzz, they hear it coming and they just, you know. Unfortunately, guys are wimps. It's always the 30-year-old guy who comes in with the Harley-Davidson shirt and the chain and passes out. It's never the ladies, by the way. But guys get metal in their eyes, and ladies don't. Yes?
Can they feel it, or is it just like, are
No.
they just nervous not to have it?
Yeah. They don't feel it because of the anesthetic in there.
Oh.
So usually they don't even feel that piece of metal in their eye. The eye is just really sore. But if it's a big chunk of something, like I had a patient a few years ago, had a piece of broccoli in his eye. Yeah, he was a chef, just chopping away and put broccoli in his eye. And he could feel that every time he blinked. Yes.
Does the rust like move with
No.
when the eye moves, or is it
Yes.
stuck on?
So it's stuck right in the eye, so when the eye moves, it moves with the eye. And a little trick I learned a few years ago, if I'm going to take something out of somebody's eye, I put anesthetic in both eyes. And you're like, why would you do that? Well, because both eyes are numb and they don't blink. Yes?
So, if you had something like that in your eye and you just like left it in there, what would it do?
You just develop a really, really bad eye infection. To the
Oh.
point where you could lose the eye.
Oh.
What is that? It's rust. Okay. So can you imagine if you're in a third world country and don't have access to eye care, what are you going to do? You're going to have to get it out by yourself with a Q-tip or you get in there.
What is the weirdest thing that you've seen in an eye or something that's like wrong?
Well, you got to remember I've been doing this 3 decades. And I don't remember a lot from 20 years ago. But like the piece of broccoli in the eye a couple years ago, that was really strange. I've had a couple colleagues have patients come in with ticks in their eye, like stuck right in the white part of the eye, like a little deer tick. I've not seen one. Jessica, you only know it was a short time. Anything really stand out that you've seen in the office? Like, what is that?
Just the cyst that I got to see her remove off one eye.
Yep. Patient came in with a cyst on the white part of their eye. It was a big clear bubble, pretty good size. And so I put some anesthetic in there and lanced it, and then just the fluid ran out of it. Yes?
How often do you see stuff like rust or broccoli?
Yeah, you know, it varies, it goes in streaks, probably twice a week.
There was one just last week
Yeah.
on Friday.
The other thing that happens, guys will get stuff in their eyes Wednesday, and they wait till Friday at 4 o'clock and they call, because it might affect their weekend. If it affects their work, they don't care, but if it's gonna affect their weekend, then they call. Yes?
So when I was in Northern, my teacher told us about how his brother or his cousin was working on a basketball hoop, and he was using a screwdriver because it was stuck, and it went
Yeah.
right into his eye.
Iris.
How would you?
There's not much you can do at that point. You know, I'm gonna send them off to a surgeon who's gonna try to repair the eye, they may or may not lose it. You know, eye stuff happens, it's freaky. 4 years ago, 5 years ago, I'm at West watching a soccer match, indoor soccer, and a young lady took a soccer ball to the face, and the ball compressed enough that it caused a bleed inside of her eye. So I looked at her eye, because I ran right over to the office here, it was half full of blood already. From a soccer ball, look how big a soccer ball is, right? And your eye is kind of recessed, but the ball was traveling so fast, it had compressed a little bit, and it had damaged the eye. So, yes?
I was gonna say there's something like whack the ball or something.
Oh, like into the eye. Right, right. Well, you just have to put some anesthetic on the eye and just slowly pull it right straight back out. By the way, if you ever get poked in the eye, like into the eye with a stick or something like that, don't pull it out. Just leave it in there until somebody looks at it. Okay?
Does the body stuff ever like affect their vision?
No, no, not at all. People come in with an eye problem and I'll put the anesthetic drops in right away. They're like, "Can I have some more of that?"
Sorry.
They work really well. Yep. Okay, if somebody has an eye injury, we might patch the eye to let it heal. All right, next. Another example of some eye trauma. Again, this looks worse than what it is.
This guy talks smack to me.
This is actually Mr. Kostruski's eye, and this trauma was from Mrs. Kostruski?
Yes.
All right, next. Okay, this is interesting. What doesn't look right here? There's two things. Light, yeah, good, good. So normally, this should not look like this. This is a grade 4, very mature cataract from eye trauma. So blunt force trauma caused a cataract to develop in this eye to the point where the patient couldn't even see you waving their hand. And what else do you see that looks abnormal here? How about the pupil? Yeah, right? The shape of the pupil? Normally it should be round. This is not round. This is shaped like a cat almost. All right. So that means the iris, which is the brown part of the eye, is torn down here. All right. So it caused the pupil to be misshapen. That's not repairable. The cataract is.